Okay, so if you've read and understood, considering it clinical examination station, please begin.
Okay. Hello, I am Dr. Ahmed Awad, one of the surgical doctor. Can I confirm your name and age, please?
Yes, I'm Tom, 55 years old.
Nice to meet you, Mr. Tom. Now I have been asked to examine you regarding your legs and your pulse in your lower limb.
Yes,
That
not
include
lower limb,
looking
your legs.
your legs and taking a close look and feeling your pulse also to do some special test. Are you okay with this?
Yes.
Okay, can you expose your legs, please?
Okay.
Okay, can you walk for me for a few steps?
Okay.
Okay, and return back. I want to take a close look to your legs, okay?
Okay.
Now I will inspect for any peripheral cyanosis or any gangrenous toes or ulcer or any previous scar in his foot or legs or even in the thigh or anterior of the thigh or any scar of the venous of the varicose vein. Also, look to the color of the foot. Also, I will do capillary refill for the toes. Also, I will do palpate. I will do the burger test for each legs by 10 degree every 10 seconds, and I will see right and left. After that, I will do palpation. I will feel the temperature of the legs. Also, if there is any tenderness over the foot or leg and thigh. Then I will palpate the pulse and the femoral pulse and the popliteal pulse. Also, I will dorsalis pedis and palpate the posterior tibial artery. If any one of them I cannot feel it, I will use the Doppler ultrasound.
Okay.
Also, after that, I will uh, do ABI, ankle brachial block, ankle brachial index, taking the blood pressure from the systolic blood pressure of the leg of the ankle from posterior tibial artery or dorsalis pedis, and systolic blood pressure of the brachial artery and David, and the normal is 1. If it's any decrease, it means there's a decrease below the point 0.8. It means ischemia of the lower limb, suspicion of the lower limb. I will do bilaterally for the both legs.
Okay.
Okay, then I will do uh, a color change test. Elevate the affected the legs. I will elevate the both legs for 1 minute. Then I will ask the patient to sit on the edge of the bed to see the color change in his leg. If his ischemia, it will be hyperemic in the legs of his affected legs. Uh, Also, I will ask the patient to start the examination of the neurologically, include the sensation, power, and reflexes, also proprioception. Also, I will examine the special test for the spine, like leg raising test, uh, and see the tone of the and the coordination of the both lower limb. And thank the patient. Then I will wash my hand and I'll see.
Okay. Can you
Yeah,
please
thank you.
summarize your examination?
Today I have been examining this 55 years old patient complaining of bilateral lower limb pain, increasing with the walking. By inspection, there is no scar, no redness, no ulcer.
Yes.
By burger test, burger test was positive for 30 degree of the angle, burger angle 30 degree. Also, ankle brachial plexus was point 0.7 in the right side or bilaterally. Also, there is a loss of hair and shiny skin and guttering of the vein in the by
Yes.
inspection.
What is the terminology to describe this?
Chronic lower limb,
Lipodermatosclerosis and hemosiderin
yeah,
deposition. Yes.
yes.
And
Also,
and
and gate if there is a gator, there is a gator ulcer or
okay.
hyperemia
And
or fibrodermatofibrosis,
on
and
Doppler assessment, what did you find?
in Doppler assessment, there is a I assess the ankle brachial plexus and confirm the pulsation in the dorsal speeds and common carotid artery, posterior tibial artery.
Basically, you're telling me the arterial examination that
Yes,
you would do to complete your examination, right? Abdominal
yeah,
examination and the arterial examination. What
yes.
about the venous examination? Because here patient has
Half inch in both lower
yes,
limb.
yes.
Okay.
So what venous test? If you'll do the Doppler, right? So it should demonstrate or it should confirm incompetence at the sphenofemoral junction, right?
Yeah.
How would you confirm that? You'll held the Doppler at 45 degree and then
Then I will press the saphenofemoral junction
yes, and you'll
occluded
squeeze the
by
cuff, patient's
yeah
cuff, yes,
cuff,
and
and
then
it will transmit the sound of the wave to
squish
the
sound
yeah
as you'll
yeah
squeeze. So
yeah.
that'll be the confirmation, right? And you should also do the Perthes test and the tourniquet
Berthesis, yeah
test. Yes.
yeah.
How do you do the tourniquet test?
Tourniquet test. I will
And Trendelenburg's test.
yes. Birth test. I will use the tourniquet from down below the knee, 10 centimeter,
Yes.
and above the knee, and above and in the upper thigh below the saphenofemoral junction.
Yes.
And I will assess every time. I will assess where is the incompetent valve. The other thing is to ask the patient to walk, right?
Yes. And
And the other one, uh, I just remember the tourniquet test. This one from below the knee, above the knee,
okay.
and
What would
saphenofemoral.
you do if there is only one tourniquet?
Tourniquet. At first, I will. Yes, I will start from the below the knee, above the knee, and below the saphenofemoral junction.
Okay.
Yes.
Right. Please tell me, right, for this particular patient, what further investigations would you ask for?
For this patient, I should do venous Doppler
Venous
ultrasound
duplex, yes.
to rule out the DVT. Also, CT angio for both lower limb and
Yes.
abdominal.
Yes.
Maybe also do a CBC, kidney function, lipid profile, and BT,
Please,
INR, breath.
okay,
Yeah,
tell me
yeah.
what management can you offer this patient?
Conservative management,
Yes, please.
that mean muscle strengthening, also elastic stocking
Very good.
and elevation of the legs.
Yes.
Also, may he need anticoagulant.
Yes.
to
And
prevent DVT.
before that, exercises to avoid prolonged sitting and standing.
Standing.
Okay. Then what if conservative management fails? What is the invasive non-operative management that you can offer?
May sclerotherapy.
Very good.
And,
Or radio frequency.
or ligation. Yeah.
Or photocoagulation. Okay. If this fails, then what is the next step? Invasive or the operative therapy that you can offer?
Ligation of the incompetent valve.
Yes. So what are the complications that you can expect to see with that management?
It could lead to infection and nerve injury.
All right.
Yeah, and yes.
Okay. Anything else?
Worsening the symptom or not relieving the symptoms, maybe.
Okay. Yes, and there could be risk of recurrence with that.
Okay, recurrent. Okay.
Good. Thank you.
Ma'am,
Yes, please.
can I add something?
Yes, sure.
Yes, Dr. Ahmed described very nicely, ma'am. I consider that he gives the attention more in the arterial disease, maybe.
Yes. Yes.
My
Yes, yes.
observation.
Yes, we.
Yeah, and the scenario was the varicose vein.
Yes.
Yeah.
It's,
He realized. He
yes,
realized.
yes. And about the smoking, he can take the smoking history a little bit more, I think.
No, in examination station, you are not allowed to ask any questions. You can give instruction for examination.
Yes, examination.
But yes.
Yes.
But you can't.
Right.
Ask.
And he should do the Trendelenburg test, Fagan test, and Parthas test.
Yes.
I should do all of them, ma'am.
Yeah.
Hmm.
Thank you.
Thank you, ma'am.